So why do so many people still have what they call osteoporosis or osteopenia, despite the fact that they're drinking their milk, eating their cheese, taking their calcium supplements? The answer to that really, to some degree, has to do with the fact that you can take in a lot of calcium, but the problem is that calcium has to be directed somewhere. There's calcium in your muscles, in your bone, in your blood, all over your body. Calcium plays a critical role in many metabolic functions within your body, or systemic functions. The problem with that is when you sit there and you take in calcium through milk, through food, and presumptively assuming that you absorb, that calcium is actually in your blood system. It's not actually in your bone. So it's not really going to have any real impact on your bone structure as a whole in terms of whether you have osteoporosis or osteopenia. You also have to keep in mind that bone structure is not just calcium. It's comprised of over 10 different minerals as a whole. It's almost like the calcium is actually the hardener for concrete. It doesn't make the concrete, it just contributes to the hardening aspect of the concrete. And calcium is sort of the same way. So when you sit there and you're taking in the recommended dose of calcium every day, unless that calcium is actually being directed directly into your bone structure, you may find it in your muscle, in your blood, or in your heart. It may actually cause hardening of your arteries, and so it could be anywhere in your body. So that's why whenever you take in calcium, and especially when you take in vitamin D, you really should be taking vitamin K2 with it. This actually can help to direct that calcium that you do absorb into your bone structure and keep it out of areas you don't want it in.